let me open with a word of prayer, okay? A gracious and loving God, whenever we gather, we give you thanks. No matter what we're going through or where we are in life, we are sure that you are with us. So God, keep us alert and agile. Help us to become the church at its best, faithful, inclusive, and full of life and love for all. This is our prayer. Amen. Friends, we gather this morning on behalf of the General Commission on the Status and Role of Women, and I bring you greetings from our General Secretary, Dawn Wiggins-Hare, who is presently preparing for the General Conference Zoom informational, which I know many of you will be joining over the next 2 days. And so she would be glad to see that we're gathering in this way on this morning. And we have a special guest coming before you, Reverend Diane Kenaston, and we'll hear from her shortly. The other person we have from GCSRW is my colleague, Eileen Delgado, and you'll hear from her as well. Diane, I'm wondering if we want to shift our agenda based on who is present. You know, you need to let me know what your thoughts are.
I think there are enough people here who are new to the work that we'll go ahead and share. And if you know this information, just cheer along in the chat.
Mm-hmm. And the good thing is that this will be recorded, so you can point your other friends and colleagues to the link, and they can learn a thing or two about the need for parental leave policies within our denomination. So won't you join me for a word? What's our first slide? Let me let Eileen run a slide or two.
Our first slide is the purpose of GCSRW.
GCSRW, yep. It is a mandate in our book of discipline, and it also states that every annual conference shall have a COSRO. So if you do not have a COSRO, maybe you and some other women or men would opt to lead such a group in your annual conference. Let me share with you then the word of God. This is from 1 Timothy chapter 3, verse 15. For if someone does not know how to manage her household, how will she care for God's children? This passage may be familiar to us. We can see clearly that Paul is indeed under assignment for Christ, our living hope. In other words, he's saying, here are some instructions, all the best, and then kind of walking away. And we know, well, I don't know about you, but I don't always align my thoughts with Paul's thoughts. But here I wanted to press some specific concerns and highlight the purpose of the General Commission on the Status and Role of Women. Our responsibility is to challenge the United Methodist Church, including its general agencies, institutions, and connectional structures, to a continuing commitment to the full and equal responsibility and participation of women in the total life of the church. You see, we're helping the church recognize every clergy and lay, women and men, adults and children, as sharing fully in the power and in the policy making at all levels of our church. For us, that understanding leads us to the importance of practicing healthy boundaries. Now, pastoral care is vital in building up God's kingdom. We strive to build healthy relationships with parishioners to strengthen the body of Christ. Together, we can live into God's will and expand the beloved community. Too often, though, we are expected to be everything to everybody all of the time. And this part of our culture needs to change. And it's up to us, the church, to build stronger relationships one with the other. Healthy boundaries lead to healthy relationships, which results in healthy churches. So I don't know about you, but I've had some problems along the way setting boundaries in the local church. Sometimes we feel guilty because we know how much the congregation depends on us, and we give in very easily. We cut our vacations short. We come back for different events in the life of the church. But one characteristic of a healthy church is having healthy leaders who take their Sabbath, who worship outside of their work responsibilities, who feed their souls with prayers and devotions and singing, and they surround themselves with people who encourage them to pray and play and enjoy life. It's a constant reminder that you are not alone on the journey. Friends, when we carve out time for self-care, we take our vacations, we use our sabbatical leaves and educational and spiritual growth leave, which can be up to 6 months while keeping your appointment. We participate in continuing education leave at least 1 week every year. This is outside of your vacation time, and 1 month during every quadrennium. Congregations need to shift their thinking, and we have to help them. When the church values pastors as parents, we will make space to support parental leaves that are fully paid and offer health benefits so that you and all of our siblings in the ministry can receive 13 weeks of paid leave. We know that we are pushing for our church to become more inclusive, and women still are discriminated against. So we just must own that. And that's why there is a GCSRW. Our congregations are made up of more than 60% of women, but many churches still want a male pastor. When our understanding of inclusivity shifts, then perhaps we will see some change in our culture as a whole. But I am real hopeful, and I believe that we have the power to rewrite the narrative. The psalmist says, "Don't you see that children are God's best gift?" We celebrate the arrival of children to the family. We celebrate grandchildren in our churches that are not even members of our congregation. And you too should be celebrated. Changing the culture of the United Methodist Church takes courage. And we are courageous people. We won't stop. We'll keep moving and moving until everyone acknowledges women as equal policy and leaders in the United Methodist Church. If you want to know what we want, ask us, and stop making assumptions about what is best for us. Yes, we are all made in the image of God, but we are different. We come with various gifts and needs and cultures and traditions, and they all need to be honored in the name of Jesus Christ. Part of celebrating means providing time for parents to bond and care for their new additions to their families. So friends, today, let's reclaim our power to advocate for full acceptance and participation of women in every sector of our denomination, to speak up for equity for all lay and clergy across the United Methodist Church and society. We are committed to serving God and to caring for our whole selves. This requires the support of every sibling. Children are a blessing, whether or not we are biologically related to them. Thanks be to God. Amen.
Amen.
When we talk about carving space for children, we mean it in the fullest sense. Sometimes when we are in worship settings, people will be very annoyed by the sound of a baby's cry. And I was always taught that when you hear babies cooing and fussing, that's a sign of life within the congregation. We have to hone that understanding and share it, right? Verbally, written, or you maybe need to make a video about it so that others will begin to understand how important young children are to the life of the church. Eileen, can we go to our next slide, please?
Yes.
So let me just tell you briefly, I won't take up too much of your time, but what we do is very important to the overall life of the church. I'm the Director of Leadership and Accountability, and my role is to support and encourage and educate our women throughout our annual conferences and our central conferences. So you can contact me for resources or for trainings and such. And so that covers kind of leadership and education. Sexual ethics, you know that we have sexual ethics training that are mandatory. And the hope, the hope is that everyone would engage in these trainings, including our lay leaders, so that we would have a better understanding of what is acceptable behavior and what is not. And then, especially as we approach General Conference and Annual Conference, we will have monitors monitoring our work, because that's where we get our data, and the data does not lie in this instance. So we can go to the next slide, Eileen. So for instance, in 1972, there were 0 clergy women as delegates to General Conference, whereas in 2019, 33.3%, it could be 36, I get my numbers confused, of the women were delegates. That's because clergy women, mind you, they just weren't being chosen. And so we have to get behind one another and offer our names up when it comes to nominations and other leadership roles. We wanted to share with you our legislation as we approach the General Conference. We've broken it down into 3 areas of our work, as you can see before you. In this first one, amend paragraph 4, is highlighted for me because it's been before the church for the past 30 years. It has passed on the General Conference floor, but has not been ratified in our annual conferences. So once again, it's coming before us. And the change in that paragraph 4, Article 4, is to include the word gender. It says that the United Methodist Church accepts all people of all ages and nationalities and so on and so on, class, education, but it does not include the word gender. And we believe that we need to be included in that constitutional statement. So we have the amendment paragraph 4, the eradication of sexism in the church, and every barrier down toward a full embrace of all women in church and society. When we get to sexual ethics, we have 4 areas of concentration. So our legislation is very easy to share with someone. So GCSRW has 10 pieces of legislation, and you can go to our website to find them. And at the end, we'll give you a QR code as well. So share it in as many spaces as you can. And sexual ethics is really important, and some of these are new. The apology from the General Conference to the victims and survivors of sexual misconduct in the United Methodist Church. So I don't know how much your annual conference had to give toward the Boy Scouts judgment, but I think ours was in the 3 million or something like that area, and nothing has been said about women who have suffered abuse and misconduct. So please pay attention to all of those legislative pieces under sexual ethics. And then the complaint process equity. All of these, especially the very last one, that you would have a response team ministry for sexual misconduct. That's asking every annual conference to have people who are not involved with the incident to give voice and to help them come to a resolution, a just resolution. So please pay attention to our legislation and ask any questions that you might have. If you want us to speak to your delegation, we are also available for that. Eileen?
Just real quick, because I know we want to get started on the conversation with parental leave policies. I just wanted to highlight our events. I know not everyone here is attending General Conference. But if you are, this is here. We, of course, have our women delegates briefing on Monday, April 22nd. We've got Thursdays in Black, which is an international campaign. We're encouraging everyone to wear black on April 25th. We will have a part of our morning worship that is going to follow Thursdays in Black liturgy, and we'll be handing out stickers to all the delegates that look just like that. And we also have our service of lament, confession, and hope on the second Monday of General Conference, and that is to just acknowledge the hurt that has been caused to victims and survivors of sexual misconduct within the United Methodist Church. So if you guys have any questions on that, you can reach out to us, or just, follow us on social media. We'll keep posting about that.
Thank you, Eileen. And once again, we are just honored to have Reverend Diane Kenaston with us. She is an elder from the West Virginia Conference and the co-founder of the Good Friday Collaborative. I'll say, unfortunately, again, women are most likely to have churches that will close or be merged. And she speaks to that quite effectively. She is an inspiration to us all, and she has gathered us together today to share beyond her grassroots group what we can do when we collaborate together. So I'm going to turn it over to Reverend Diane Kenaston.
Thank you so much, Denise. I am so grateful to be here today, and I'm going to be sharing my screen as well. So you all know we may need to go over just a little bit for our presentation today, but it will be recorded for anybody who needs to hop off at the at 12:30 Eastern or 11:30 Central. So thank you. As Denise shared, I'm delighted to be here on behalf of a whole movement of people, a grassroots movement to improve parental leave in the UMC. And our goal is to strengthen and clarify what currently exists. And I'm so grateful for CASR's support in this endeavor. All right. So today I want to start with clarifying why we're here. Then we'll get on the same page about what it is that we're talking about, including definitions and how this relates to the Family and Medical Leave Act in the United States. And it's important to note up front that this work is specific to the United States. Much of the current Book of Discipline, including the paragraph on parental leave, assumes a U.S. context, a context that is behind the rest of the world. Here in the U.S., we have a particularly unhealthy culture around parental leave, and many other countries are far ahead of the United States on this topic. For example, in Mozambique, the government guarantees 60 days of maternity leave that is paid at 100% of the woman's regular salary. And in contrast, in most parts of the United States, the government guarantees 0 days of paid leave. These regional differences affect the churches in each region. And so our parental leave work here is an example of how important it is that the General Conference pass regionalization in 2024 and that the annual conferences affirm it in 2025. Keeping in mind that context, we will then look at the current Book of Discipline and what needs to be strengthened or clarified. The 2024 General Conference will not be addressing paragraph 355 on parental leave. However, there are things that can be improved on the annual conference level, and so we're going to focus our energy there. So today, near the end of our presentation, I'll present a multi-step plan for change, and this includes model legislation that you can bring forward in your annual conference. And finally, I'll invite you to join this grassroots movement and stay up to date on what you can do to make a difference. We will have time for Q&A as we go along, and hopefully a more extended Q&A at the end, although like I said, some of that might go over the hour that we had allotted for this coffee chat. Just go ahead and type your questions and comments into the chat as we go. So, why are we here? We each have a story of what brings us here today. And I'd like to start with my story, which is a lucky story. Although we won't have time to share your stories of what brought you here today, I do encourage you to think about your stories. Your story, like mine, can be the start of the conversation that needs to happen in your annual conference. As for me, my lucky story is that my parental leave was about as good as it gets under our current system. For starters, I was lucky enough to be the 5th female pastor at the church I was serving. And since my immediate predecessor had her baby while pastoring, the church members had recent experience in supporting a new clergy mom. I was also lucky because the church had the funds to pay for people to cover pastoral care and preaching during my leave. I was also extremely lucky because my husband got off of his work after the birth. And because we were both on parental leave, we set up equitable parenting strategies right from the beginning. Like, since I had to wake up to nurse, he needed to wake up, bring me the baby, change the baby's diaper, and then take the baby back to bed. It was only fair. Parental leave is not only for women. And one of the biggest challenges for mothers is the lack of parental leave for their partners. Women's liberation is tied to liberation for all genders. I was also lucky that I had no medical complications and I had a baby with no medical issues. I share all of this luck because what I experienced is considered a best case scenario in the United Methodist Church right now. All of the stars aligned so that I had a supportive congregation that could afford for me to take time off. I had a partner who could take paternity leave, and the baby and I had no medical issues. And I want to give thanks for all of the previous generations who have made my lucky experience possible. My experience was light years ahead of what my pastor father went through when he had to leave the delivery room to go lead a funeral. And when, as an associate, his senior pastor called him to ask, "Why aren't you in the office?" on the day my sister was born. Back then, when the United Methodist Church instituted an 8-week maternity and paternity leave policy, we were trailblazing a path among mainline denominations. However, just because it's better now than it was in 1985 doesn't mean that we've reached perfection. We are still going on. And it is time for the UMC to relook at our parental leave policy for the next generation. Because over the last 30 years, other denominations have leapfrogged over the United Methodist Church in terms of what they provide for their clergy. The Presbyterian Church in the USA, for example, guarantees 12 weeks of paid parental leave. Meanwhile, I went back to work after 10 weeks. And I did this because I had saved up my time off and I added 2 weeks of vacation onto the end of the 8 weeks guaranteed by the Book of Discipline. For the record, caring for the baby was not vacation. I did know that according to the discipline, I could take weeks 9 to 13 off as unpaid parental leave, but it honestly never occurred to me to do so. We needed my income, especially because of how expensive it is to have a baby in the United States, both in terms of medical expenses and the upcoming huge childcare costs. And once again, this is a decision that our US society has made. In countries like England, there are 0 hospital bills when you give birth. So like I said, this is a regional issue, and this is why the church needs regionalization. But since I was pastoring in the United States and not in England, I went back to the church after 10 weeks. I couldn't afford to stay home any longer. This meant that I went back to work before the end of the 4th trimester. And you've heard of the 3 trimesters of pregnancy. The 4th trimester represents the 3 months after giving birth. And this 4th trimester is crucial for maternal and infant health. So even with all of my luck, even with the best case scenario, I didn't get the time that the World Health Organization and International Labor Organization set as the standard. They say 14 weeks should be the minimum standard for maternity leave, and they recommend 18 weeks, both with paid cash benefits. So it is time for the UMC to rethink our standard. More importantly, it is time to make sure that parental leave isn't something that a pastor lucks into. There are huge disparities in how United Methodist clergy experience parental leave. My lucky experience was the exception. The differences vary wildly according to your gender, your race, your local church, your annual conference. Small churches may want to support the pastor on leave, but they also really need that pastor back. Financially struggling churches are faced with extra expenses that make it difficult for them to support the pastor, even if they want to. And clergy men are afraid of retaliation against the cultural stigma against men taking their leave. So these clergy men are taking 0 time off or just 1 week. Clergy women then face even more resistance because their male colleagues aren't taking their leave. Non-traditional clergy struggle to find other people to replace them in their unique settings. For example, church planters can end up running social media for the new church start, even though they're technically on leave. In some places, district superintendents require clergy to come back for charge conference or decom meetings. Boards of ordained ministry require people to attend residency while on leave, with the alternative to delay ordination by a full year. And then there are issues beyond our control, like when babies end up in the NICU for an extended period, or when postpartum depression hits hard. With all of this variation, there is no normal experience of parental leave. Too much is left up to interpretation, and there are too many loopholes. It is luck that determines whether you have a good leave or a bad leave. And when we rely on luck, vulnerable people are disproportionately affected. White women like me are more likely to have luck, to have that best case scenario experience within our current system. And this is why we can't depend on luck. In the US, maternal mortality has spiked. 1/3 of these maternal deaths occur after the birth of the baby, precisely the time that should be covered by parental leave. And we know, according to the CDC, that Black women are 3 to 4 times more likely to die of a pregnancy-related cause than white women. This is a matter of life and death. It can't be a matter of luck. We need to make it easy for every new parent to access a full 13 weeks of paid leave without increasing the burden on local churches. This is why we're here. Are there any questions thus far? If so, please put those into the chat. I just see a preach, so thank you. We'll move on. We finished the why we're here section. So now we're going to look at what we're talking about. Maternity leave is for women's leave after birth or adoption. Paternity leave is for men. Parental leave is an inclusive, gender-neutral term for leave after birth or adoption. And this parental leave is our focus for today. I want to be very clear that parental leave includes both maternity and paternity leave. There is a related term called family leave, and family leave includes parental leave, but it's not limited to that. Family leave also includes caring for a seriously ill loved one, like a parent, a spouse, or a sibling. And our focus today is on this more narrow topic of parental leave, and not the expanded topic of family leave. This is mostly for expediency, because the conferences that have already passed quality parental leave legislation were able to do so by deliberately keeping their focus narrow and hoping to expand it in the future. The second reason that we're focusing on parental leave and not a fuller family leave is that the United Methodist Church already has something called family leave. And according to paragraph 354, this disciplinary family leave is a voluntary leave of absence. it changes the conference relationship, and it generally lasts at least a year, frequently longer. As far as I know, no annual conference currently has a short-term version of paid family leave. That is an opportunity for clergy to temporarily take paid time off to care for a loved one without triggering a change in conference status. However, if your conference does have something like this, please share in the chat. This is an important area for future advocacy and general conference legislation. And Sarah's saying that Upper New York has this, so we'll keep talking. But we know that this family leave is really important because women are frequently family caregivers. A final type of leave that is sometimes discussed in with parental leave is called medical leave or sick leave. And like family leave, the Book of Discipline addresses medical leave for long-term situations. Conferences vary greatly in how they approach short-term medical leave. And we have seen that as conferences expand the short-term parental leave, they may also be inspired to expand their care for clergy with short-term medical needs. This happened, for example, in the Illinois Great Rivers Annual Conference, where the young adult team requested funding for parental leave, and the Board of Ordained Ministry was inspired to create a matching funding mechanism for short-term medical issues. This is great, and you may want to consider this in your context. Are there any questions on these terms? Any questions on why we're focusing narrowly on parental leave? All right, great. We defined all of these terms in part because parental leave in the United States is lumped into a federal law for family leave and medical leave. It is called the Family and Medical Leave Act, or FMLA. Please note that I am a pastor and not a lawyer, so none of what I'm about to say is legal advice, and all of it comes from the U.S. Department of Labor website. FMLA entitles eligible employees of covered employers, in other words, this has a limited reach, to take unpaid job-protected leave for specified family and medical reasons. FMLA protects workers on leave from retaliation and guarantees that you can return to work at the same or similar job. FMLA only applies to large employers. It does not guarantee paid leave, and it is woefully inadequate. In recognition of how inadequate the federal law is, some states have passed state-specific FMLA laws. These state-specific laws vary, but some of them do include paid leave, and most of them expand who is eligible for leave. You may be fortunate enough to live in a state with an expanded FMLA program. Lucky you. And part of our work is to figure out how to integrate those cultural changes into our church work. But that is not true across the country. The church should be doing all we can to improve both state and national access to parental leave. We have the opportunity to be prophetic leaders in showing this country that there is another way to care for families. And I'm not going to pause for questions on FMLA because this actually doesn't apply to most churches, but I'm just sharing here to help set the context for church-specific policies. All right, polity nerds, pay attention. We have looked at the wider context. Now we get to dig into our current book of discipline. And as I read, I invite you to enter into the chat anything you notice about this disciplinary paragraph. Paragraph 355, maternity or paternity leave. Maternity or paternity leave, not to exceed 1/4 of a year, will be available and shall be granted by the bishop and the cabinet and the executive committee of the Board of Ordained Ministry to any local pastor, provisional member, associate member, or clergy member in full connection, who so requests it at the birth or arrival of a child into the home for purposes of adoption. As I read this paragraph and work with other people who have been involved in this grassroots movement, There are two things that come to mind. One is it's great that adoption is included, but there's nothing in there about foster parenting. And second, 1/4 of a year is nowhere defined. Some annual conferences interpret this 1/4 of a year to mean 12 weeks. And I think that this is influenced by the length of FMLA's unpaid leave of 12 weeks. But if you actually divide 52 weeks by 4, then 1/4 of the year is 13 weeks. 13, not 12. But that's vague, and conferences are interpreting it differently. The paragraph continues with number 1. Persons desiring maternity and paternity leave should file their request with the Committee on Pastor-Parish Relations after consulting with the district superintendent at least 90 days prior to its beginning to allow adequate pastoral care for the churches involved to be developed. Here, note that 90 days can be very difficult for some adoptive parents. And although we just had a whole bunch of people review the request, as Eileen points out in the chat, we said that they shall grant the leave. The word request here can make it seem to staff parish that this is optional. And there can be informal pushback to clergy taking this leave. This is especially true for men who seek to take leave. Number 2, during the leave, the clergy members' annual conference relations will remain unchanged, and the health and welfare benefit plans will remain in force. This is good. Yay. Number 3, a maternity or paternity leave of up to 1/4 of a year will be considered as an uninterrupted appointment for pension purposes. Read the other way, our pension is affected if we take more than 13 weeks of leave. Number 4, compensation will be maintained for no less than the first 8 weeks of leave. In practice, this means that weeks 9 to 13 are usually unpaid. And even clergy who do a great job of reading the discipline, like me, don't even know that they can ask their congregation to pay for more than that. There's also a big question. Who's funding this? Many small churches can't afford to pay both their pastor on leave and the people who are covering for the pastor. So of course, they're going to want to limit this to 8 weeks, the no less than. Number 5, during leave time, pastoral responsibility for the church or churches involved will be handled through consultation with the Committee on Pastor-Parish Relations of the local churches and the district superintendent. Unfortunately, as I mentioned before, pastoral responsibilities for the are sometimes expected even during the time of leave. There's no guidance on boundaries and no word about connectional responsibilities. And in the chat, Lindsay has shared that she was a first-time foster parent while also pregnant, so kind of 2 at once. And says she remembers preaching when she was 39 weeks pregnant and needing to sit down on a stool mid-sermon, and how can leave begin before birth, right? So the timing of the leave is important too, as well as accommodations for pregnancy accommodations. All right, number 6, special arrangements shall be made for district superintendents, bishops, and those under special appointment. This leaves a big question for me since I'm currently in extension ministry. How do we care for clergy in extension ministries? Everything in this paragraph assumes traditional local church appointments. And so if you're not in a traditional local church appointment, then it can be easy to address. So, is there anything else that we've noticed in this paragraph that we'd like to bring up for conversation? All right, you might be typing. I'll just throw in a few part-time clergy. Sometimes a part-time pastor will request leave, and they're told, well, you can only take 4 weeks of leave instead of 8 weeks of leave. For example, that happens. There are questions about parental leave combining with other forms of leave, like can you take medical leave before and parental leave after the birth? We don't know We don't have anything here about grief time and compassionate leave, particularly in the case of miscarriages or stillbirths. And the language of maternity or paternity, while it's great that it's specific, that both men and women are included, it unfortunately leaves out non-binary people who are also giving birth or adopting. So those are just some of the things that have come up.
Wow, thank you.
All right. Someone's speaking. I'm not sure if they're trying to or if they just need to, or that's accidental.
That was Yvonne. Yvonne, did you want to say something? Maybe not.
All right. Thanks, Eileen. Some of the issues that we have just named can only be addressed by the General Conference and will need to be addressed in a future quadrennium. However, there are things that we can do right now, and we can do them in our annual conferences. And these are the priorities set by the grassroots organizing group. First, conferences will fund coverage during parental leave, and the conferences will ensure adequate amounts are budgeted. We know of one unnamed annual conference that currently has money for parental leave coverage, but their limited amount is first come, first served, which means you better hope you have a baby in January because there is no money left for people who have babies in November.
Diane, I'm a November baby.
Yes. So we want to make sure this is adequately funded if there's a funding source from the annual conference. We also want to ensure that these funding resources are communicated and encouraged conference-wide. We know of several annual conferences that have money set aside, but no one knows about it because the DS forgets to tell the clergy person thinking about leave. Anytime the system relies on just one person to communicate, there is a chance for failure. We also know that there are subtle ways in which people are discouraged from seeking funding. And so while policy can't address all of these cultural barriers to people taking their leave and their full leave, we want to work through the policies to begin having these conversations, changing the culture so that people are not discouraged from taking leave or discouraged from using funding that is available in the conference. A second priority is for the conferences to expand paid parental leave from 8 weeks to 13 weeks. And we believe that this first step of funding pastoral coverage will help to reduce the barriers that local churches may have in supporting leave for the full 13 weeks. Additional priorities can include providing for part-time pastors and clergy not appointed to a local church, making provisions for foster parenting, clarifying that parental leave is not vacation and that vacation and continuing education days are in addition to parental leave. Again, in some contexts, we've heard of churches trying to insist that if you take leave, then you do not get any vacation days for the rest of the year. And I think this is again influenced by that FMLA law where employers can mandate that. We also want to set boundaries that when a person is on leave, they're not required to do pastoral work, including charge conference or residency. So these are some of the priorities that were identified by this grassroots team. Are there any questions, thoughts, or responses to these? Okay. So what is next? Since the General Conference 2024 legislation deadline is long past, our interim goal is for annual conferences to pass their own supplemental legislation. These annual conference policies need to close up loopholes in the Book of Discipline, expand financial support from the conference level, and encourage men to take parental leave. And we're dividing the work that we're doing into 4 phases. In phase 0, which has already occurred, we celebrate that expanded leave already exists in the East Ohio, Illinois Great Rivers, Western North Carolina, and Western Pennsylvania annual conferences. Yay for these 4. And these 4 conferences have been key in helping other annual conferences figure out what's next. So now we're in phase 1. We have drafted model legislation, and this year we are going to pilot this model legislation in an additional 6 annual conferences. And these conferences represent all 5 jurisdictions. After we've put forward this pilot legislation in May and June of 2024, we'll enter phase 2. We'll learn from our phase 1 experiences. Hopefully, we'll be able to publicize their success, and then we will expand the work to as many annual conferences as possible. And my hope is that you here today are going to be the core of this phase 2 work. Finally, we have phase 3. Improving parental leave in all of the annual conferences will hopefully build momentum for general conference changes in the future. We'll know what we want, we'll have effective legislative strategies for getting it passed, and we will have built allies among the delegations with already improved policies. Any questions about this timeline?
I did put a question in the chat.
See that.
It says, how do I know if my annual conference has started having these conversations?
Yes, so this gets us to the next one, which is if you are interested, put your email into the chat or email me directly. So I have a spreadsheet. Our group has a spreadsheet of all of the annual conferences that are that have expressed initial interest in this. And so we are going to, so I would be able to connect you individually with the other people working on this. We don't want to necessarily publicize the list broadly. The 6 conferences for this year, I actually don't remember all of them off the top of my head. Upper New York, Missouri, one of the ones in the Pacific Northwest Episcopal area, but I don't remember which one. And then there are 2 more. There's Iowa, I believe. Ooh, I would need to look back at my list for which 6 conferences are for this year. And one of the things as we go through, we started with 7. One of them received feedback from their Council on Finance and Administration that they want to work on it over the next year. And so that's now a conference that's going to go through to phase 2. So we've got, so it's a kind of an ever-shifting list. Right. But email me and then I'll send you the model legislation, an invitation to the monthly large group gatherings, and steps for getting this passed in your context. The email might actually be hard to see. It's rev.diane, D-I-A-N-E, .kenaston, K-E-N-A-S-T-O-N, @gmail.com. Right. Thank you for putting that in the chat, Eileen. And now we can shift into Q&A for the next 5 to 10 minutes.
Did you want me to share those links?
Yes, please. I've asked Eileen to drop in the chat an overview of what we discussed today and the first steps in passing legislation. We meet as a large group about once a month on Mondays currently, and these are accountability check-ins and workshopping strategies for phases 1 to 2. Note on first steps in passing legislation, I'll go ahead and put a slide up here. This steps are you need to assemble your team, research your current policy and FMLA in your state or states, review the model resolution, policy and procedures, and then get endorsements and finalize legislation. And pre-work is essential. We have guiding questions for you to consider through your research, and we have it all laid out for you, so it should be relatively easy. The trickiest part will be finding a funding source within your annual conference, and making sure that you get feedback and endorsements from every possible stakeholder, because you don't want any of this to go to the conference floor without being thoroughly vetted. All right, I'm going to stop sharing my screen so I can see if anyone else would like to share. Any hands up or anyone like to?
I think I would like to see how many people here have already had these kinds of conversations within their COSRO group or their annual conference or even at a local church level. Sarah, I saw you raised your hand. Did you want to share a little bit about that, or?
The first thing I want to do is say that Diane's leadership has been amazing and made it all possible. So she found energy that needed a response and has given us a way to respond. And that because we have these regular meetings where we're checking in with each other, it like gave me a space to get other people connected. And Jihei is working with me. We've got a nice team in Upper New York, and Diane just mentioned, and it is kind of funny. So in New York, we have expanded paid family leave, which means that we're already getting 12 weeks, and we're doing this like 13-page piece of legislation to get us to 13. But we think it's worth it.
Thank you, Sarah. And Upper New York is really helping us to understand how FMLA, state expanded FMLA can interact with the church legislation and to get that done. I did, because I had stopped sharing my screen, I was able to get the list of conferences we're working with and share that in the chat, so you can see which conferences those are. And again, with phase one, we've got for this year, Dakotas, Florida, Missouri, New York, Pacific Northwest, Peninsula, Delaware, and Upper New York. Those are the conferences that are bringing legislation forward, hopefully this summer. And we've got a much longer list of conferences that are interested and thinking a year out, because we know that this is the type of work that involves building a coalition. And sometimes you do need a full year to get that coalition built in order to get this to pass. All right. So on Denise.
I'm gonna let you go first. Go ahead.
I was just gonna say the model legislation does address all of the many things that we didn't talk about today. So addressing things like how cabinet should approach appointments, how if there's a whole section specific for foster and resource care that isn't necessarily 13 weeks that's planned, but recognizing that foster parenting can require different timelines and needs, and how to communicate, how to expand all of this. So there are many elements of this proposed legislation that are in the fine print and not hit on the highlights today.
So one of the questions I have, Diane, and thank you for just really taking us step by step through the process and the need for this legislation, is we have some new people on the Zoom with us today who have not been a part of the grassroots movement. And I'm interested in knowing if they would like more information and if they're interested in taking this back to their COSRO group or to a group of people who have the intention of putting forth such legislation for their annual conference. So maybe you could raise your hand or put in the chat that I'd like more information, or I'm very interested. We know it's a lot to take on, especially if you have not led a legislative movement like this, but we are willing to help. So we being Diane and Denise, and then she had some other experts in her team who are willing to meet with you beyond this coffee chat. Are there any other questions for Reverend Diane? No? Well, I would like to thank you again for asking us to share this space with you, or to hold this space for you so that we could have this important conversation, and commend you for being one of the lucky ones and remembering that we don't overcome until we've all have overcome, and working with us to move this agenda forward, to have more equity as it relates to parental leaves for men and women or non-binary people who are inviting or receiving children into their lives. The church, really should want to be on the right side of this. So just for helping us be our best is what I'm saying. And so may God bless you in your ministry areas and all of you that have gathered this day. Until we see you again. Bye for now.